unfortunately, we've been doing these all virtually, and we hope in the next year or two, we can start coming back to different parts of Colorado, but we're glad in the meantime to be able to bring data to you around Dolores and Montezuma counties, as well as maybe any other questions or comments you have. As Vanjie mentioned, I am the It's About Kids Network Director. So Vanjie is a member, and we have about 70 members across the state who work every year to advocate for kids. And we kind of go back and forth on what works in the community, and then we advocate at the state level for policy. And we also rely on our leaders like Vanjie to tell us what's working and what's not working. So our presenter today, some of you may have met her in the past. Her name is Sarah Hughes. She is our Vice President of Research Initiatives. She will be doing our Kids Count presentation, and we'll take a break kind of in between each section, like sort of K-12, health, and early childhood, and just check the chat. But feel free to throw your questions in there, and Sarah will check them, or I will check them and make sure she addresses them before we move on to the next section. But as always, please let us know. We wish we could be in person, and those kind of interactions are always so much better, but we'll take what we can get. So here is Sarah, and thanks again for joining us.
Thank you, Katie, and thank you, Vanjie, for inviting us and hosting us today. And a huge thank you to all of you for taking time out of your day to be here. I know now more than ever, everybody is wearing 3 or 4 or 5 different hats. You're working, you might be a parent, you might be supervising virtual classrooms. We know that there are many competing demands on your time. So really appreciate you showing up here today to talk a little bit about how kids in Montezuma and Dolores County are doing. I definitely wish that we were there in person in that beautiful bank conference room, and I was not doing this instead next to my bedroom closet with a 7-month-old in the next room, but we will make it work, make the best of it, and dive into some of the information about how kids in your community are faring. And we'll spend some time going through the data, but as always, just like when we're in person, we welcome your thoughts and your input about how these data do or don't reflect what's going on in your communities. So feel free to jump in with examples of how you see these out, or if there are other things that are not captured in the data that you think it's important that we hear about. One of the things miss the most not being able to do our travel is being able to see and hear firsthand about some of the issues that you all are seeing crop up on the ground that might not have popped up in our data yet this year. So feel free to jump in the chat box at any time, and we'll be sure to leave some time for your thoughts and questions as we go through the presentation. So with that, I'm going to go ahead and share my screen here, and we can get started with the PowerPoint. And even though we are now 9 months into this pandemic, I still am not a Zoom expert. So hopefully this works and everyone can see the slides okay. All right, I'm seeing some head nods, great. So we're here today to talk about our 2020 Kids Count in Colorado report. And Kids Count, some of you may know, is a report that the Children's Campaign has been doing for a long time. We put it out every single year in an effort to capture the data that tell us what kids and families are facing around the state. And we hope that people will use those data in their local communities to advocate for changes there or to inform some of the work that you're doing. And we also put it out so that legislators can have a picture of how kids are faring in their districts and across the state, so that when they're making policy decisions that affect kids and families, they're doing so based on the most current reliable data that we have. So that brings me to a really important point about this year's Kids Count. Always with Kids Count, we use the most recent data that are available when we go to print. We were all set to release Kids Count this year in March, and the pandemic happened, and we found ourselves in a little bit of a unique situation, because we know that now that these data have come out, so much has changed in our lives in these last 9 months. And so there's always a little bit of a lag with the data between what's in Kids Count and what's happening in real life. But that lag seems even larger this year because all of our lives have been completely upended. And we know that we have millions of people out of work, millions of people, kids that are not in school. And so that if we had real-time data to capture what was going on right now, it would look very different from what's in this report. But we think that these data are still really important to look at, and they can still tell us a lot. They can tell us where our state has made progress for kids and families before the pandemic, and that can help inform where we might want to put forth efforts to defend that progress. We don't want to see the state going backwards on these things that many of you in this room have worked really hard for over the years. And then they can also tell us about those systems that were already really fragile before the pandemic hit and are going to need extra attention and extra support as we move forward, because we know that the pandemic has had a huge impact on all of the systems that are serving kids and families across the state of Colorado. So just thought it was important to acknowledge that, so that you're not going through this presentation thinking, okay, yeah, but a lot has changed since these numbers came out. We think they're still really important for those reasons that I just shared. So with that, we'll go ahead and jump into the first issue area, which is family economic security. And child poverty is something that we've talked about at the Children's Campaign for a long time. It's been in our Kids Count reports probably since the very beginning, because we know that a family's economic circumstances affect their child's opportunities in every other area of their lives. And before the pandemic hit, we were actually making some good progress with child poverty in Colorado. You'll see there, Colorado's that green line, and our child poverty rate held steady at about 12% of all kids in 2018, which is 150,000 Colorado kids who experience poverty. Now, that 150,000 is still much too high, but we were better off than we had been a few years prior, when our child poverty rate had peaked at 18%, or about 1 in 6 children across the state that was experiencing poverty and all of the hardships that came along with it. So we were seeing a little bit of a good news story there with that steady drop in the percent of kids who are living in poverty. But there's a couple things I want to point out about this graph that I think are going to be really important when we're talking about our recovery from the pandemic. So you can see here, we had, of course, the Great Recession that happened between 2007 and 2009 and affected hundreds of thousands of people across the state and many more across the country. And during that time, you can see the child poverty rate increased a little bit for Colorado, but then the recession ended in 2009. And you can see that even though the recession was over, that child poverty rate kept climbing and kept until it reached 18% in 2012. And we actually did not see our state's child poverty rate get back to its pre-recession level for 5 years after the recession ended. And this is really important because we are facing another economic downturn due to COVID right now, and we can't wait 5 years for our kids and families to recover. If you think about how long 5 years is in the life of a child, that's their entire early childhood experience when all of that important brain development is happening. It's almost their entire elementary education. It's more than their high school education. So as we come out of this pandemic and we begin to think about what our economic recovery looks like, it's so important that we prioritize support for kids and families and able to be in order to be able to meet their children's most basic needs. We can't wait 5 more years for our economy to turn itself around and start benefiting kids. Just one more important point here. I wanted to talk about what we mean when we say poverty. The federal poverty level that's used to determine how many kids are experiencing poverty is only about $25,000 a year for a family of 4. I think most of us here can agree that that is extremely unrealistic, expecting a family to be able to make ends meet on that amount of money. And so when we talk about those 12% of Colorado kids that are living in poverty, that's definitely an underestimate of the number of kids who are living in economically struggling families, because we could have families that are making $26,000 a year, definitely struggling to be able to pay the rent, pay for childcare, pay for healthcare, and they're not captured in these numbers that we see here. So always important to take this number with a little bit of a grain of salt. Another caveat is that it's important not to just look at those statewide numbers, because we know that Colorado is a very, very diverse state. Economic opportunity looks very different in the state depending on where you live. And so this is a map that shows child poverty rates by county in 2018, which are the most recent data that we have. The darker colored counties are places where the child poverty rate was higher. The lighter colored counties are those where the child poverty rate was lower. And you can see the tremendous differences we have. So in 2018, we had the lowest child poverty rate in Douglas County, where, excuse me, I gotta move my little video boxes out of the way, where 3% of kids were living in poverty. And then if we look south of Douglas County to Huerfano County and Saguache County, we had more than a third of all children experiencing poverty. So really, you can hide those pockets of poverty in our state if you're just looking at that statewide average of 12%. Now, if we look specifically at Dolores and Montezuma counties, Dolores County did have a child poverty rate that was higher than the statewide average at about 17% in 2018. Montezuma County was toward the higher end of that spectrum, with 29%, or almost 1 in 3 children in the community experiencing poverty, living below that very low threshold of $25,000 a year. And this is important. We can take a look at what the poverty rate for kids looks like in these communities over time as well. And you can see here that there are some similarities in the trend with the state overall. So we saw, at least in Montezuma County, an increase in the child poverty rate during the Great Recession. But unlike the state as a whole, in Dolores and in Montezuma counties, we have not yet, even almost a decade later, seen those child poverty rates go back down to where they were before the recession hit. So we still have many, many kids and families in these communities that aren't able to make ends meet and aren't able to meet their kids' material needs in a lot of instances. I wanted to talk again, though, for a minute, just to put those numbers in context about that federal poverty level measure that we're using, and then what's probably closer to the actual cost of living in Montezuma County, to put that 29% child poverty rate in perspective. So we talked about how the federal poverty level for a family of 4 was about $25,000 a year. There's another measure called the self-sufficiency standard that is a little bit better, or a lot better, I should say, than the federal poverty level for many reasons. Number one, it varies based on differences in cost of living from place to place. If you live in Aspen, your cost of living is going to be very different from someone who lives in Lamar, for example. And so this self-sufficiency standard takes those differences into account. And then if you look along the right side of the slide here, you'll see all these different budget categories. These are all included in the self-sufficiency standard, things like childcare, healthcare, transportation, all the things that we're spending our money on every month. None of those expenses are really broken down and included in the federal poverty level. So this measure is better for a few different reasons. Now, if we look at that for Montezuma County and add up these categories, we have this family type, two adults, a preschooler, and a school-age child spending almost $9,000 a year on housing, over 15 grand on childcare, several thousand on food, transportation, healthcare, miscellaneous expenses, taxes. By the time we add all of that up, that self-sufficiency standard, just what a family would need to kind of break even and meet their basic needs, adds up to almost $57,000 a year. So that is more than twice the federal poverty level. And if we look at the percent of kids living below twice the federal poverty level in Montezuma County, it's closer to half of all kids that are living in families having trouble making ends meet, which is significant and is hidden by that 29% that we see when we just look at the child poverty rate. I don't have a slide for Dolores County here, but I did look up the self-sufficiency standard for them, and for this same family type, it's about $55,000 a year. And if you have other counties that you're interested in, I'd encourage you to look at the Colorado Center on Law and Policy's self-sufficiency standard report, because they have this broken down for all 64 counties across the state. So we'll pause there and just see if there have been any questions coming up in the chat box. And I'm not seeing anything. Feel free to jump in there if you do have a question that's come up. All right, well, in that case, where do we look again for self-sufficiency? It's called if you just Google self-sufficiency standard Colorado, you should probably find the most recent report, or if you want to go to the Colorado Center on Law and Policy, or CCLP's website, they should have the most recent version of the report there because they're the ones who put it out for Colorado. Thank you. All right, well, we will go ahead and move on to child health. And we all know that putting children off to a healthy start involves making sure that their moms are off to healthy starts during pregnancy. And so, thank you, Katie, for putting that link in the chat. When we look, though, at infant and maternal health indicators in Montezuma and Dolores County, we see, whoops, my slide doesn't want to move there. There we go. We see that too many moms and babies are facing barriers to a healthy start in these communities. So if we look at, for example, births to women with early prenatal care, this means that the pregnant person was starting prenatal care in the first trimester of their pregnancy. Statewide, that number is around 82%, but in Dolores County, it was only about 2/3 of all pregnant moms getting that early prenatal, and only around 3/4 in Montezuma County, so both below the statewide average there. Another indicator we look at is births to women who report smoking during pregnancy, and smoking during pregnancy is associated with a lot of negative outcomes for moms and babies, one of which is low birth weight births. And when we look at that indicator, we see that in Dolores County in particular, the rates are very, very high. Almost, I guess, 7 times as high as the statewide average, with 40% of all births in that county in 2018 happening to women who reported that they smoked during pregnancy, and much lower in Montezuma County at 10%, but still higher than the statewide average. We see a similar pattern with low birth weight births. Low birth weight means that a baby was born weighing 5.5 pounds or less. And here we can see that about 1/5 of all babies born in Dolores County were born at a low birth weight, 11% in Montezuma County, both higher than that 9%. So some opportunities here to make sure that we're connecting pregnant women to early prenatal care and helping with smoking cessation in particular, because that seems to be a challenge that more women in Dolores County are facing than we're seeing in the statewide average. And then finally, if we look at the infant mortality rate in Montezuma County, at least, we didn't have data for Dolores County, but we see that the infant mortality rate in Montezuma County was more than twice as high as it was across the state of Colorado in 2018. And infant mortality refers to the death of a baby in their first year of life. So really, really tragic circumstances for these families. And again, a higher rate there for me. And this is an area the Children's Campaign has started doing kind of more and more policy work on maternal health in recent years, just recognizing that you really can't separate the health of moms and babies. And so if and learning more about what that policy work is, we're happy to connect you to the appropriate people in our organization, because I know they're trying to do a lot of outreach to people across the state to hear what the barriers might be to care for moms and babies. We'll shift gears a little bit now and talk about the uninsured rate for kids here in Colorado. We had been making really significant progress here in our state on making sure that kids have access to health coverage. We know that health coverage is critically important, not just for making sure that kids can get the health care that they need, whether that's preventive care like immunizations or care when they're injured or sick, but it's also extremely important to a family's financial circumstances. Just one small injury without health insurance can really wreck a family's financial security. And so we know how critical that insurance coverage is to protecting families' economic circumstances as well. And over the past several years or so, if we look back at 2008, we saw that our uninsured rate for kids was at 14%, so a little higher than the national average. And we had almost 180,000 kids without health coverage at that time. Then over the next few years, between 2008 and 2013, there were some state level policy changes that were made, things like expanding access to public health coverage through the Child Health Plan Plus, trying to make programs like Medicaid or CHIP Plus a little bit more efficient for families to use. And together, those state policy changes kind of chipped away little by little at the uninsured rate for kids in our state, and it reached about 9% in 2013. 2013, many of you may remember, is when a lot of the provisions of the Affordable Care Act took effect. So Colorado expanded Medicaid for adults, which helped get kids connected to coverage as well. And then we also implemented Connect for Health Colorado, or the healthcare exchange, where people can get subsidized coverage. And you can see those changes really accelerated that drop in our uninsured rate, and it fell by more than half in just a few years' time. So that by 2016, our uninsured rate for kids was at a record low of 4%, or 57,000 kids without health coverage. So in that less than 10-year time period, more than 120,000 children across the state gained access to health coverage, which is pretty amazing progress, and shows just how much public policy really does make a difference in the lives of kids and families. Unfortunately, since 2016, though, you'll see if you're looking at the graph here that it has not been as much of a good news story for Colorado kids. We've started seeing that progress erode in the last few years. And as of 2019, about 6% of Colorado kids were uninsured, or 73,000 kids. And if we look just at the year between 2018 and 2019, we saw 10,000 kids lose coverage just in that time period. And this is extremely troubling at any time, but it's particularly troubling when we know that we were about to go into the worst health crisis that anyone alive right now has ever seen in the United States. And health coverage was going to be more critical than ever. And so it's very troubling that we saw so many more children losing coverage during that time period. So this is an area where Colorado really, really needs to try to protect that progress and make some policy changes to get things headed in the right direction. We can also look at these trends for Montezuma and Dolores counties, and you'll see a similar trend here. Montezuma and Dolores started off with uninsured rates that were much higher than the state average. So almost a quarter of all kids uninsured in Dolores County in 2008, about 1 in 5 in Montezuma County. And then over the next few years, we saw that really steep drop to around 7% in 2016. And you'll see that just like the state as a whole, it's kind of flatlined since then. So we aren't seeing that amazing progress anymore that we were seeing in the years immediately after the Affordable Care Act was passed. And you can't talk about health coverage in Colorado without talking about the important role that Medicaid and the Child Health Plan Plus, or CHIP Plus, play. These are publicly funded programs that serve families meet eligibility requirements and have income below a certain amount. So Medicaid serves kids and families earning below about 138% of the federal poverty level, and CHIP Plus serves kids and families making incomes that are too high to qualify for Medicaid, but below 260% of the federal poverty level. So CHIP is more of those middle income families. And these two programs together cover about half of all of the 1.2 million kids across the state. So they are a really critical piece of the puzzle in making sure that kids have access to health coverage. And they're even more important here in Montezuma and Dolores counties. So you can see in Montezuma County, 3 out of 4 children were either Medicaid or CHIP Plus at some point during the year, and 63% in Dolores County. So these are really critical programs that we want to protect and defend, because we know how important they are to families across the state and being able to get that health care that their kids need. Unfortunately, however, we're seeing an increasing number of kids who are eligible for one of these programs but are not enrolled for one reason or another. And this could be for many different reasons. It could be a lack of awareness of the program. It could be not wanting to engage with a government agency. It could be stigma of the programs. There are lots of different barriers that families when they are trying to enroll their child in Medicaid or CHIP Plus. And so it's not a huge percentage of kids, but we can see that it is an increasing percentage of kids who qualify for Medicaid or CHIP, but are not enrolled for one reason or another, almost 6% in 2018. You guys, though, in Montezuma and Dolores County are doing a better than average job at enrolling eligible kids in these programs. So we can take a look at a similar statistic for kids who are eligible for public coverage but not enrolled in Montezuma and Dolores counties. So if we look at CHIP and Medicaid, only about 2% of all eligible kids in Montezuma and Dolores counties were not enrolled in 2018, which is below the statewide average. So you guys are doing better than the state as a whole. Doing really great at Medicaid, where the Colorado Health Institute estimates that there were no kids who were eligible for Medicaid who were not enrolled in 2018. The rates are a little bit higher for CHIP, with about 12% of eligible kids still uninsured, but again, doing better than the state as a whole. And then if we look at Medicaid Plus and the tax credits or the subsidies that people can get for coverage all lumped together, Montezuma and Dolores, again, doing a better job there of connecting kids to this healthcare. So kudos to you guys for the great work that you're doing to get people covered by the programs that they qualify for. I'm going to shift again a little bit now to talk about mental health struggles. And I know this has been something that is at the top of everyone's mind during the pandemic. The way that we are all living right now is not really conducive to having great mental health, with all of the many challenges and pressures that people are facing now on top of the ones that they were facing before the pandemic. And even prior to the pandemic, we saw that mental health challenges affected far too many youth in Colorado. So what you see here is a slide showing the percent of high school students reporting different mental health struggles in 2019. And the percentages are very, very high and very sobering, I think. So the green bars that you see here are the percentages for Colorado as a whole, and the blue bars are the percentages for the region. This is how they publish the data for this data source. That includes Montezuma and Dolores counties, along with La Plata, Archuleta, and San Juan. And if we look, for example, at the percent of kids who are sad or hopeless almost every day for 2 weeks, which is a very typical symptom of clinical depression, that was almost 1 in 3 children across the state and in the region that encompasses Montezuma and Dolores counties. 1 in 3 high school students reporting this symptom of depression. It was around 1 in 6 reporting that they had seriously considered suicide in the past year. 14% made a plan about how they would attempt suicide. And finally, almost 1 in 10 of our high school students reported that they had actually attempted suicide in the past year. So again, this is when I talked about those areas that were troubling even before the pandemic, this was one of them. And we know that teens are probably struggling even more now with all of the pressures that they're facing and the ways that their lives have been turned upside down. And so we know that that need for mental health support is going to be critical now and moving forward. These numbers are just really staggering, I think. Also staggering, unfortunately, is our actual teen suicide rate here in Colorado over the last few years. Colorado has historically had a relatively high teen suicide rate. That's been true for a very long time. We tend to have a rate that's higher than the national average. And in recent years, that rate has reached levels that we've never seen before. So in 2015, we saw a huge jump in the teen suicide rate, up to about 20 deaths by suicide per 100,000 teens ages 15 to 19. And we had hoped that maybe 2015 was just a bad year, just a blip on the radar, and we might see those numbers go down. But as you can see, they really have not gone down in recent years. They've remained almost just as high. And again, this just it really illustrates the urgent need that we have in Colorado to be supporting our young people and our teenagers with their mental health. And just to put that rate in perspective, that 18 per 100,000 rate is about 69 teenagers who tragically lost their lives to suicide in 2018. We typically in Kids Count have reported only on that 15 to 19 year age range because that was the age range for whom suicide was most common among younger people. However, in recent years, we've seen, unfortunately, suicide becoming more and more common among that young age group of 10 to 14 years old. We've actually seen the rate for that age group more than double since 2010. So this is not an issue that's just affecting our adolescents, our older kids. It's affecting kids as young as elementary school now. And I think really illustrating that need for mental health support to start very, very early rather than waiting until a child is in high school or a teenager. And if we look again at your region, we don't have data specific to Montezuma and Dolores counties because they don't report really small numbers. But if we look, zoom out a little bit and look at the region as a whole, that includes Montezuma, Dolores, Archuleta, La Plata, and San Juan counties, 7 teens ages 15 to 19 lost their lives to suicide in this region. It's something that's affecting counties all across the state, whether they're urban, rural, Front Range, Western Slope. It really is happening everywhere. So I'll pause there and see if we've had any questions pop up in the chat box. And if you've been holding on to one, feel free to type that out now.
I'm not seeing any questions, Sarah.
Okay, thank you, Vanjie. If you have any that come up as we're moving along, feel free to type it in and we'll get back to it at the end of the presentation. So moving on to early childhood, I want to first about, if my slide will move, that is, access to childcare in Colorado. It's probably not a surprise to many of you if you have young children that Colorado really has a shortage of childcare across the state, which places a huge burden on families and on employers. It's hard to obtain the types of employees that you need if they if potential employees don't have a safe and stable and consistent place for their children to go during the workday. And I think many of us have seen firsthand just how critical that childcare is to being able to work during this pandemic when many people have not had access to that care. And you can see here that in recent years, we've had many more children under 6 who likely need childcare than we have slots available. So across the state, we have about 2/3 of all kids under 6 who likely need childcare. They have all of their parents in the workforce, but we only have about 58, we only have enough slots in our licensed childcare centers, family childcare homes, and preschools to serve 58% of those children. So again, this is putting families, communities, employers in a huge bind when there isn't necessarily a safe and stable place for the child to go during the day. And I should say too, we know many families rely on family, friend, and neighbor care, and that care is critical to the child care system in Colorado. We just don't, unfortunately, have numbers to be able to quantify that care, and that's why we're looking here only at licensed child care settings. And we know that, again, the picture looks very different here across the state. So this is a map that shows the number of children under 6 who likely need childcare per licensed slot that is available in their community. And the darker colored counties, places like Rio Blanco, Park, Elbert, these are places where the childcare shortage, at least in 2018, was kind of the most dire. Montezuma County was kind of in that middle category with about 2 children who probably need care for every licensed slot. So again, this is an issue that doesn't discriminate between rural, urban communities. It really is a challenge almost everywhere across the state of Colorado. And I'll just point out, unfortunately, we don't have good data here for Dolores County since it's so small. It's harder to get those accurate numbers here. And this is another area where we know that the pandemic has almost made this crisis even worse. We don't have updated numbers on childcare capacity in kids who need care, but we do have some data from a survey that was conducted by an organization called Early Milestones Colorado, and they found that between March and June of 2020, so those first few months of the pandemic, 10% of providers across the state had to close their doors, and across childcare, licensed childcare settings, there had been a 30% drop in enrollment. So childcare is another one of those systems that we really as a state need to be prioritizing as we come out of this pandemic, because if we're expecting people to be able to go back to work, people are going to need somewhere for their children to go during the day. And so we were excited to see during the special session of the legislature that happened within the last couple of weeks that there was some legislation passed to hopefully give childcare providers some relief, because we know that our economy doesn't work without childcare, and we need to have a strong system of care for when we come out of this pandemic, and even once we're back into regular life. We'll also talk a little bit about access to preschool. We know from the limited data that are available that preschool access has been very limited in Colorado. Only about half of all 3 and 4-year-olds in our state are enrolled in any type of preschool program as of 2018. Now, not every family may choose preschool for their children, and that's completely fine, but we know that there just is not enough access to preschool for those families who would choose it, with only half of all kids being able to be enrolled. And when we also break down this data even further, we see that unfortunately the children who often benefit the most from preschool opportunities are children in low-income families, children of color. These groups of children are unfortunately the least likely to be enrolled in preschool programs. And these programs are really critical to preventing that achievement gap, or often it's called an opportunity gap, that we see between different groups of kids once they get into the K through 12 system. So it's discouraging that we have these gaps in access to preschool along racial and economic lines. We also see differences in preschool access looking from county to county. And I think counties in southwestern Colorado provide a really good example of how preschool enrollment can vary dramatically across county lines. So if we look at Montezuma County, for example, about 31% of all 3 and 4-year-olds were enrolled in any type of preschool program between 2014 and 2018. If we look just on the other side of Montezuma County at La Plata County, the preschool enrollment rate was double at 62%. Now, I know there are a lot of differences between La Plata County and Montezuma County. They're very different communities in many ways, but what shouldn't be different is a child's access to preschool based on where they live. So no matter what community kids are living in, if their parents want them to be in a preschool program, they should have access to a really high quality program that's going to get them prepared for kindergarten. We are hoping though, just to give you some good news here, I feel like we could all use some of that. We're hoping that we're going to see these numbers change dramatically in the years ahead, however, and that is because of Proposition EE, which was on the 2020 ballot across the state. And this was a proposition or a ballot initiative to provide a universal half-day preschool for all families who need it, and that would be funded by a tax on vaping or e-cigarettes. And fortunately, this initiative did pass by an overwhelming margin. And so the Children's Campaign, along with lots of partners around the state, are going to be thinking about how do we design that preschool program to make sure that it's what communities want and it's what parents want and it's meeting the needs of young children across our state. So this is a huge, huge thing to celebrate for Coloradans all across the state. And I'll pause there and see if there are any questions that have come up since our last section. I'm not seeing anything. So if you have them, just type them in the chat and we will get to them after the last section, which is K through 12 education. And I'll hit you with some back-to-back good news. That is, never wants to progress once I get to. There we go. The good news here is that we have thousands more children in Colorado able to benefit from full-day kindergarten in the most recent school year where we have data. So historically, Colorado has only paid for about a half day of kindergarten for all students. And if school districts wanted to provide full-day kindergarten, they either had to charge parents tuition, which could be unaffordable for many families, or they had to come up with some other local source of funding like a bond or a mill levy in order to be able to pay for that second half of the day. So it was a big strain on a lot of districts' resources to be able to provide that full day program. However, in the 2019 legislative session, we saw our take action to expand full day kindergarten and make full day kindergarten available at no cost to families if they choose that option. And so as a result, just in 1 year, we saw the number of Colorado kids in a full day program jump by 12,000 kids. So we now have almost 100%, 97% of our state's kindergartners enrolled in a full day program. And we know this is a huge benefit to families. Finding care for that second half of the day can be very difficult. And it's a huge benefit for kids who are now able to get that those learning opportunities in that second half of the school day. And we can also look at these numbers going back over several years for districts in Montezuma and Dolores counties. Montezuma County historically had been pretty far below the state average, but then in recent years, you can see that full day kindergarten enrollment has jumped up to either 100% or just right below 100%. And you might be thinking, oh, if we were already paying for full day kindergarten, or if we already had this resource, are we really going to benefit from the fact that the state is now funding it? And the answer to that question for most districts is yes. With the state picking up that funding for the second half of the day, many districts find that those local funds that they might have been putting toward full day kindergarten are now freed up to pay for other education priorities in their communities. So again, it really was a win for people all around. And historically, Colorado has struggled to offer resources like full day kindergarten and other educational opportunities that we know benefit our children because our funding system for schools in the state is very outdated. The school finance formula has not been updated since 1994, if you can believe that. And it's very inequitable in terms of how it allocates money from district to district. And so as a result of our funding situation, we see a pretty big gap here between per pupil spending in Colorado compared to the national average. There was a more than $2,000 per student gap in funding in 2015, 2016, which is the most recent data that are available. And $2,000 might not sound like a lot, but when you multiply that $2,000 gap by the 900,000 students that are in our public education system, that is a huge amount of money that we're shortchanging our students by, that we're not putting into our education system compared to the national average. And I think more funding doesn't automatically equal better outcomes for our kids, but there has been a lot of research to show that if you increase school funding and if you invest it in the right places, you do tend to see better academic outcomes. And if we take a look at some of the academic outcomes for Colorado kids, I think we can all agree that they're not exactly where we would like them to be. So one way that we assess students in Colorado is through the CMAS assessment, or the Colorado Measures of Academic Success. And if we look at those measures in English language arts and mathematics, we see that across the state, fewer than half of all students are meeting or exceeding expectations in English language arts, and only about a third are meeting expectations in math. And those percentages are lower for Dolores County and for Montezuma County school districts. So again, funding is not the absolute end-all be-all answer to improving student achievement, but we know that the things that do help improve student achievement are very difficult to afford if you don't have adequate funding in your school district. So keep an eye out for more information. If you get our Kids Flash newsletter, you'll see some info occasionally about work that we're doing to try to modernize our school finance formula and improve it so that we can give our state's kids the education that they need and that they deserve. Finally, the last indicator we'll look at here is the high school graduation rate. This is something that we've seen steadily improving here in Colorado since 2010. And seen a steady improvement in Montezuma County as well, going from about 64% of all kids graduating high school on time within 4 years in 2010 to almost 80% in I have to move my windows again here in 2019. But I think, again, we can all agree that we would like these numbers to be higher, both statewide and in the two communities that we're looking at today, because in today's economy, it's very, very difficult to be able to make ends meet if you don't have that high school diploma. So I know I just threw a lot of information at you, and I know that Zoom fatigue is a very real thing these days. So we will go ahead and wrap up with the data, but I just wanted to leave you with a couple of takeaways here. Hopefully you saw from these data that we did, before the pandemic, have a couple of things that were going really well for Colorado. We had expanded access to full day kindergarten for all students. We have a new investment in preschool for all kids across the state. And these are things that in these tough budget years that are to come, we really need to focus on protecting and making sure that we don't lose the progress that all of us have fought really hard for over the last few years. Secondly, we were seeing improved economic security for families before the pandemic, with fewer children experiencing poverty than they had in recent years. But again, this progress has likely been reversed in most places around the state as folks are out of work and struggling to provide for their families. We also talked about some of the challenges that could get worse if we don't take action from a policy standpoint. We've seen our uninsured rates start to inch back up again after that amazing progress that we had made in the last decade or so. And this is particularly troubling given that we're in the middle of a public health crisis. We need our kids to have health coverage. We also saw on many different indicators a really urgent need to support the mental health of our kids and teens, with record high teen suicide rates and 1 in 3 high school students reporting symptoms of clinical depression. We had childcare shortages before the pandemic, and likely those shortages are even worse now because we know the toll that the pandemic has taken on our providers. And then finally, we have some work to do on our state's school funding system to ensure that districts across the state are able to provide those resources that kids need in order to learn the skills that they'll need throughout their lives. So I'll leave you. I know everyone's looking for more things to do right now, as if we don't have enough things on our plate. But if you have a few spare minutes, I'll give you a couple ideas of just little ways that you can help Colorado prioritize kids and families in the months ahead. One really easy way to stay apprised of what's going on at the state legislature and hear about opportunities to speak up for kids in your community is to sign up for our Kids Flash newsletter. If you don't already receive that, we put it out once a week, Friday afternoons. It can be some really interesting weekend reading for you if you like. And you can sign up for that by visiting our website at coloradokids.org. Secondly, we are always posting opportunities on social media, whether on our Facebook page or our Instagram or Twitter accounts, for ways that you can speak up and reach out to your elected officials and tell them what's important about your community and what kids in your community are facing. To give us a follow on there and stay up to date on those advocacy opportunities. So with that, I will pause and catch my breath and see if we have any questions that have come up throughout or any that you guys would like to throw in there right now.
So Sarah, I did ask on the CMAS scores. I'm trying to remember if we're lower than we're as low as we are because of the opt-out part. Is that a big part of it?
Good question. So that data does not include kids who opted out. They're kind of taken out of the data altogether in that percentage. But those kids who, it depends, you don't really have a good sense of who is opting out there. So it's really not giving a full picture necessarily of the proficiency of Montezuma County or Dolores County kids if you have a significant number of kids that are not taking the test. And I don't know what that percentage is off the top of my head, but I know that has been a conversation in recent years that we're having more and more families opting their kids out of the CMAS assessment.
I think we have one superintendent on from Dolores School District. Liz, are you on? Do you know what Dolores's opt-out rate looks like? She may have left us.
And Vanjie, if she's not here, the state does publish that information, so I can always send it to you, and you can share it with people if people are interested in that.
Okay.
We also had a comment that for math in particular, the state's competency numbers are really high. That's I think at the state board level, they set the cutoffs for what the scores should be at the different categories. And so we have heard people say that perhaps in some instances, those cut scores are not realistic. So thank you for sharing that context too. Any other questions or thoughts or things that you think it would be important for us to hear about kids in Montezuma and Dolores counties?
This is Jessica Randall with Team Up, and I have a question. I think it's more out to the general community. I know that Opinion Project used to have some specific funding to helping with enrollment in healthcare coverage, and it helped people get enrolled in Medicaid and CHIP, as well as the marketplace insurance. And it's my understanding that that isn't available anymore. And I wondered if there is anyone else in the community that's offering that assistance for healthcare enrollment, because I would think that that would be a big hit to our enrollment rates in this county to no longer have that service available.
So if you're on the call and your agency does provide those services, please chime in. So Jess, it sounds like no.
Yes, this is Katrina from MECC. I know that it did go to Access after Opinion, so that may be a way to find out if you ask Access.
Yeah, well, we do have a couple of Access folks on, so I don't know, Katrina. Anything else?
Vanjie, this is Gina from Social Services. It was my understanding that Access was going to help with the Medicaid enrollments. And I thought they were getting referrals, but I can't talk for them specifically, but that's what I understood.
Yeah, that's what I thought too. And you do some of them too at Social Services, right?
Well, in terms of when they come in, of course, we would help them with their Medicaid enrollment. But, you know, with other community members and making referrals, they usually go to Access to do that. And I have one more question for the facilitator. You talked about the K-2 funding that was outdated in Colorado. What's being done now to address that issue? Because you said the funding model went back to 1995. Is that what you said?
Yes, it goes back to 1994 since there have been any significant updates, and that's just to the formula, so to the way that we allocate school funding to school districts. There have been a few different efforts in the last several years to try to adjust that formula. There was one back in 2013 that actually passed the legislature to revise the state school funding formula. But it going into effect was contingent on a statewide ballot initiative. I believe it was Amendment 66, but don't quote me on that. But that would have provided additional funding that would have allowed this revised formula to go into effect. Unfortunately, that ballot measure went down very hard and did not pass. And so that change to the formula never ended up happening. And then we've seen, I think, some efforts. The Children's Campaign, my colleague, Leslie Caldwell, is our education policy person, and she's been working over the years to try to revise that formula and help it make more sense for the century or the millennium that we're now in, since it's been so long since we've updated it. And I think one of the issues is that our state legislature does not have the power to raise taxes to go toward education. So they don't have the power to add revenue into the funding system. And so if you're not adding new revenue in and you're changing that formula and changing how money gets allocated to districts, you then have like some districts that are winners that are getting more funding, but since there's not more funding overall, you then have some districts that are losing funding, that are not okay then with that formula being changed. And so that's kind of where a big hangup is for Colorado, is that we can't put more money into the system. So we're kind of making people fight problems that we have there. And so as a result of that unique nature of tax policy in Colorado, it's really difficult the state legislature to agree to change the formula. But if that's something you're interested in, number one, I'd be happy to connect you to our education person. And number two, it's something that we write about from time to time in our Kids Flash newsletter. So you can stay up to date on the policies that we're working on to try to change that. But it's just been something that's really hard to get agreement on at the state legislature.
Sarah, I have a question. Earlier, you mentioned something about an outreach for moms. What can you kind of go over that a little bit more?
Sure. Was there a specific issue that you were thinking about, or just to moms in general?
Well, I don't know. I thought you said that there was maybe some kind of initiative for new moms' health or before moms.
Yep. So we have a couple of colleagues our health policy work, Erin Miller and Sam Espinoza, and actually JC Price as well. So there is a coalition called Raise Colorado that is co-convened between the Children's Campaign and I believe Clayton Early Learning, and they are focused explicitly on infant and maternal health. And I know I can't, Katie might actually have more information on the specifics of their work, but I know they've done like listening sessions with people to hear from moms who are recently postpartum pregnant about challenges that they've faced. We've also been doing some work on maternal mortality over the last few years. There's now a maternal mortality review committee that anyone can apply to be on. And I know they're often looking for real people with real experiences. And so I'd be happy to, thank you, Katie just put the Raise Colorado link in the chat box. So that's there. And then my email address is here if you're interested in learning more. I know I didn't have a ton of specifics about what the initiatives were, but we have staff that are leading them, and I'd be happy to connect you to them as well.
Yes, and this is Katie. The Raise Colorado Facebook page is out there, but we also, like Sarah said, they have been doing listening sessions around some of their 0 to 3 work. And then as Sarah mentioned, prenatal and postpartum depression issues, all sorts of like maternal mortality issues. There's a lot of different ways to either provide input on how your county is facing some of these issues, or to hear how people are addressing these issues across the state. So we'd love to hear from you. Let us know if you have any other questions.
Well, I don't see any more in the box, and I'm not hearing any more. I will send the link to the recording out, and I'm guessing that I can get a link to the slideshow, right? And what are we doing about hard copy books? Will we be getting any of those to give to agencies this year, Sarah?
I'm going to actually punt that to Katie because I think I was on leave when that process was discussed.
Yes, punt it to me. I was just trying to unmute myself. So we printed a very limited amount of books, so we will not be sending around any more this year. And I don't know about next year, just because we are not even in our offices and print shops. Like everything has been delayed. So we did an initial printing, which each IAK leader got a couple, and then the legislators got like a hard copy, but we didn't print like we would normally do.
Okay.
So we have the Kids Count Data Center online that you can check out via our website, as well as like you can check out your county, and the county data sheets are also available. sometimes that's really helpful. And Sarah, if there might be another like resource to point them to, but I think you could get your info just as quick that way and print it.
Yeah, I think so too. Yeah, I knew I got a couple of books, but I wasn't sure because I've had some people ask. So when I send out the follow-up email, I'll just include the link to the data center.
And I can send to Vanjie, if it's helpful, the data sheets specific to Montezuma and Dolores counties, like the county data sheets in the back for you to send out to people too, if they don't want to scroll through all 100-something pages of the report.
Sure, we can include those. That'd be great. Well, thank you so much for all your time and effort pulling this together, Sarah and Katie. And I see where I got one of the special only paper copies. So I feel quite special. And thank you everyone for attending and learning more about what's going on. It's going to be really interesting in the next couple of years seeing what the pandemic does to the data.
Yes, absolutely.
All right, if there's nothing else, thank you all for attending and be watching your email for a follow-up.
Thank you.
Thank you. Good to see everyone.
Bye.
See you later.
Bye-bye. Bye, Sarah. Thanks so much.
Bye. Thank you, Vanjie.